If you're having any potty problems, you're likely also having a lot of other problems. I just created this free ebook, and I am going to take a few minutes to tell you what's inside the book in this video blog. Hi, I'm Dr. Mary Barbera, autism mom, board certified behavior analyst, registered nurse, and online course creator. Each week I provide you with some of my ideas about turning autism around. So if you haven't subscribed to my YouTube channel, you can do that now. I just created this free ebook. It's free right now. It's a little over 20 pages in length. You can get it. I might decide to sell it eventually or at some point. But right now, when I'm recording this, you can get it at marybarbera.com/potty. In addition to being a behavior analyst and being the mom of 2 young adult sons now, one with autism, one without, I have been a registered nurse since the mid-1980s. And when we're talking about a bodily function like potty training, I do think that my long career as a registered nurse, I still maintain my license, so my long career in that field, especially my work with neurologically impaired patients, really helped guide me into the world of potty training my 2 boys, as well as potty training or helping to potty train many of my clients. You may or may not know, if you're a parent or professional in the autism world, that I have online courses now. I don't have a standalone potty training course because I truly believe that if you are having problems with potty training, whether your child or client is 4 or 5 years of age, or whether they are 14 or 40 years of age, if you're having any potty problems, you're likely also having a lot of other problems like problem behaviors, not talking a lot, not conversational, failure to go through the daily routines on by themselves, safety concerns. So there's a whole lot of issues that are going on, and so I don't really want to spend time just talking about potty problems. Potty training is covered in my online courses currently. In the guide, as I said, it's 20 pages long, and I just printed out the first 5 pages here so I could show you. So in the table of contents are things like research in the field of autism. A lot of behavior analysts I know say they do the Azrin and Fox method, and there are some steps in there that can become extremely problematic. And I go over those steps and what to do instead. When to start toilet training? Are there prerequisites? Are there readiness skills? Is a child ever too low functioning, quote unquote, to be potty trained? Where you start, whether you're going to do a scheduled training or more intensive in the bathroom method, or some combination of both of them, what materials you need, who's going to coordinate between school and home, and just all kinds of problems. Then we talk also about bowel training and wiping in this free ebook, nighttime training, and toileting accidents or regression after the child is toilet trained. So it's a very meaty book. I'm very proud that I was able to put it together and we were able to offer it for free. Again, that is at marybarbera.com/potty. How my approach differs than Drs. Azrin and Fox's approach is in 2 ways. They have basically 5 steps in their procedure. Including the 3 steps that I do use. So I'm going to tell you what 3 steps I do use and the 2 steps that I no longer use. Schedule, putting the child on a schedule, whether that is every 15 minutes, every half an hour, every hour. In the beginning, it's going to have to be more frequent. Extra drinks, especially if you're trying to get them potty trained quickly. Extra drinks that are consistent. So not just like he has 2, Capri Suns at lunch and then he doesn't drink the rest of the day. So it needs to be extra drinks and more consistent drinks, like 4 ounces an hour, for smaller children or more than that potentially for older children. So scheduling, extra drinks, and data collection. And it doesn't have to be scary data. It can just be whether they sat on the toilet, whether they peed, when they had a bowel movement, either in the toilet or in a diaper, those sorts of things. So it doesn't have to be hard data, but it needs to be some information that we can make data-based decisions. But Dr. Azrin and Fox, in their book, Toilet Training in Less Than a Day, which was published in 1974, also includes 2 steps: dry pants checks, which involve keeping the child in underwear and visually inspecting the underwear on a time schedule. You can see how that might not be appropriate, is not appropriate in, say, a public school setting where the child would then just be in underwear. That would not fly these days, even if they're behind a partition, those sorts of things. So dry pants checks are kind of out with my approach, as well as positive practice, which is a punishment procedure and in most cases not legal to carry out within public school settings, especially without really having a system of positive reinforcement. So I have my approach, which differs than what a lot of behavior analysts are following right now in terms of toilet training. So you want to check out the guide at marybarbera.com/potty. I do have a podcast on potty training, marybarbera.com/podcast. And I have a podcast on the topic as well, but I wanted to do a short video blog as well. I know I'm not able to get into the full guide and everything, but you have it handy. You have other resources. I am going to be talking about pottying throughout my online courses and community. If you'd like to find out more about joining those, you can go to marybarbera.com/workshop. If you like this video, give me a thumbs up, share the video, leave a comment, and I will see you right here next week.